And what Matt is talking about is this exceptional opportunity that we have for clinics and prescribers to grow their patients by both attracting new patients and retaining them. Our drug, Kaisertrax, is an FDA-approved oral testosterone replacement therapy. Its effectiveness, safety profile, and convenience ensures high patient satisfaction and adherence, which then translates into rewarding financial model for clinics, which I'll detail a little bit later. Another important factor that you ought to know about right in the intro is our cash pay model avoids insurance company pre-auths, rejections, and delays so that patients can get the therapy started as soon as possible, and clinics don't have that administrative overhead of and headaches of dealing with PBMs.
And that's the goal here. Like we know the jig's up. Look, if you are not taking in cash paying strategies with something as simple and as non-evasive as what you're doing, I mean, why not?